Hi, I'm Mike Goad. I'm one of our mobility solution architects. With me, I've got Preston Harris, Brent Soloway, and Anthony Gargano. And today, we want to talk to you how we enabled clinical mobility.
45 days to deploy 2,250 devices. Wow, right? So that great story, and it's all about helping out patients, right? We see a lot in the clinical mobility space at the point of care. If you've ever visited a hospital, you know sometimes there's a big whiteboard in your room and the entire care routines, you know, people are writing, hey, I should be here at this time. It's sort of silly. It was really about digitizing that entire experience, streamlining the workflows, and giving nurses more time to get in front of their patients to provide care, right? And so we put together a great solution to help that happen. So let's talk about that today, right? How do you make a better patient outcome happen? How do you make IT happy? And maybe how do you improve, the relationship with your account? So Mike, when we think about clinical mobility and collaboration and mobilizing the EMR, what are some of the trends you're seeing out there for organizations that are trying to do these types of things? And pretty much, I think you and I both see as solution architects, this happens all the time. Folks are trying to use smartphones to really mobilize the workflows.
Yeah, the trends that we're starting to see in it, and it comes down to communication paths and different work streams. So if you think about it, a nurse, let's target nurses. They walk miles a day. So, and they're going between one end of the healthcare facility to another end of the healthcare facility. So, how do they get a hold of another nurse, of a specialty, a technician, or something like that? What is the reachability? What does that communication path look like? Can I just message someone if it's something quick that I need to reply to? How do I get a hold of them? How do I look up my directory and figure out who I need to connect with? So it's about looking at technology and software solutions, enable the nurse to just do their job. Pick up an iPhone, have the software just get out of the way. It's just, I need to get a hold of someone. How do I make that happen? So those are the trends that we're starting to see, and the solutions and partners that we work with, like Patient Safe, Mobile Heartbeat, Apple, that enable that type of.
So let's talk about this specific opportunity.
When they were looking to evaluate between Patient Safe and Volt, and sat down with us, and we're kind of overwhelmed as to like what components do we need. We know next to nothing about the solution. How do we go about deploying this? Like what's going to be the amount of investment that we're going to need within it? And so we engaged both Preston and Michael, in order to sit down with them and really talk through some of the steps and what's going to be needed.
Great. So let's talk about what was in the solution build, right? So they asked us for the platform, they asked us for iPhones, but really, what kind of things do you need in order to make this whole thing work for nurses?
This solution was a combination of CDW, Apple, VMware Workspace One, and ground control. And it was the idea of how do we just, again, enable a nurse just to pick up an iPhone and go. So Apple became the hardware platform that runs the software. VMware became the platform that we manage the devices. Then ground control became the platform that we use to provision and troubleshoot and just enable that. Tap your badge in and pick an iPhone up and go. So that's what that partnership looked like.
So this is sort of a thing like every time a nurse comes to work, right, shift change, we start all over because that device needs to be re-provisioned. There's a lot of sensitive information, and so it has to sort of be reset, and that becomes it's almost like every day is Groundhog Day. Right? So we got to build a solution the right way to make sure the information's respected and appropriately taken care of, and that nurse has a reliable experience. But I want to talk a little bit about the initial deployment. Can you tell us a little bit about what your customer's experience was around the initial deployment?
So, the first batch of phones, they rolled out 500. It was more of just kind of a testing for them to kind of see what the process would be like, how long it would take to start getting the bulk of the, phones out and into their, clinician staff. So, they started around September, took them, about a couple months to get those going. And then around the March timeframe, it was really their big push, where they rolled out another 1,800 phones. And in reality, it only took about 45 days for them start to finish, get everything deployed, and then the carrier's hands. So pretty smooth process all around. I think one that they were happy with and pleased with the turnaround time.
So 45 days till you're probably talking multiple hospitals, a lot of floors, a lot of different folks involved. So that's actually pretty darn amazing. So there you have it, 2,250 devices, 45 days. So thanks. That's Clinical Mobility. Have a great one.
Thank you.